All right, so welcome to the second Keys to Sustainability webinar. Today we're going to be covering the topic of empowering staff and how we retain staff. So as you know, the basis of these webinars are going to cover different topics that span for sustainability and how we can help make sure that your programs are sustainable. So we covered getting grounded in person-centered care in our first one. And then in October, we kind of took a different spin of giving you all the opportunity to attend the NADZA boot camp that was more focused on marketing and recruitment for your programs. And so now we're going to be switching gears and focusing on how can we empower our staff and how can we retain those staff, as we know that that's a big issue right now in this workforce. So I am delighted to introduce Lakeland Etchenberger, who is from Home Instead. She is going to be giving our presentation today on this topic. So I know that she will give a quick intro on herself and we'll dive right in. And then I am sure that she has left some time for some Q&A at the end if there are any specific questions on the program. So Lakeland, I'll go ahead and turn it to you, and I believe you should be able to share your slides from you. Lakeland, are you ready on your end? Message her and make sure she can hear me. You all can hear me, right? Okay. All right, she may be having some audio technical difficulties, so we're working through that. Bear with us for a second. It's the birds that I told you about. That's what happened.
I was just going to ask, is that you typing or are those the birds pecking?
Oh, that was actually me typing, but was not the birds pecking.
I'm joking, yeah.
Hi, everyone. I'm so sorry. Somehow my computer muted. And so I am so glad you messaged me because I didn't know that you introduced me. So I have no clue what you said, but I'm sure it was wonderful. I apologize. That's never happened before to me. How embarrassing. How long have we been using Zoom now?
Yeah, no, it was the birds, Lakeland. It's okay. We
Yeah.
have an out.
I think you set us up for that when you talked about how eerie it was to have all those birds. But anyway, I had a high school teacher who always said, technology is great when it works. So today is an example of that. Well, excited to be with you all today. Thanks for inviting me to speak on empowering and retaining staff. I'm sure maybe in the introduction, and forgive me if I'm repeating something you've already heard, I am part of the Alzheimer's Association's thought leadership group, the Dementia Care Provider Roundtable, and we've had a lot of robust discussion about workforce over, the last couple years of meeting, because hiring, retaining staff is really challenging in a variety of the settings that we deliver and support, deliver care and support individuals living with Alzheimer's disease and other dementias. So it's been very top of mind for our group, and we published an article that I am going to kind of dive deeper into the recommendations of in today's presentation. So I am going to share my screen here. And hopefully technology is on my side now. Can you see the slides? Is it in slideshow mode? Cool. Okay. As I'm sure Isabella mentioned, I am a gerontologist and caregiving advocate for Home Instead. We are a global home care provider, and we have locations in all 50 states. I work for our global headquarters and I wear a variety of hats, one of which is overseeing some of our recognition programs of our care professionals. I also support our training initiatives and then do education and kind of PR marketing efforts externally for family caregivers, professionals, and families. So that's a little bit about me. A few years ago, Home Instead partnered with the Global Coalition on Aging, really on a report that was put out on the needs of the workforce as we support the growing number of older adults. And this report had several recommendations that I just wanted to share. I'm not going to go into too much detail on this. It really was more of a high-level report, but I think what it speaks to is while we're all feeling kind of these retention workforce issues in our local communities and in our programs, it really is a global issue. We're seeing a demand for care and support of individuals that are aging, of individuals living with cognitive impairment. And so we need to work hard to find, recruit, and most importantly, I would say retain really high quality employees. So this report kind of hit on four different things. First, I'm sure many of you might agree that the perception of this kind of work, this direct support of aging individuals or individuals with cognitive impairment, it's not necessarily valued by society. And so therefore, it's not always a job that's top of mind for people. So this report really challenges us to change the perception of this type of job and to make it more of a desirable career. If you think back to like teachers and nurses, over the years, there's been a lot of campaigns really on just public awareness around the recruitment and the value of those types of professions. Wouldn't it be really cool to see a national campaign like that for those direct care workers that support aging adults? I think that would be really cool. So I think that that is something that sometimes is working against us. Also, the report recommends training and education standards to really ensure quality care. I know the Alzheimer's Association has been a huge champion of training and education so that we can deliver on that quality of care. And Home Instead shares that same value. And so over the years, we worked with the Alzheimer's Association to improve and grow upon the dementia care training that we provide. And they have a lot of great resources. Another is to support and reward and really recognize the value that this job provides. And so I'm gonna share some examples as we go through. And at the end of this presentation, I'm gonna open it up for discussion because I want to hear kind of what you all are doing in terms of your engagement and recognition and retention efforts in your local programs. So excited to hear more from you. And then this report really zeroed in on the home care workforce. So it also had a fourth recommendation on helping the healthcare system see home care as part of the health and social care ecosystem. Many of the respite services that you all provide, you might have similar feelings. We may not be classified as healthcare providers, but we provide really important care that is often has elements of hands-on care. And it really is an extension of that healthcare system in a way. And so I think that we also need to be seen as part of that care ecosystem. So anyway, if you want to learn more about this report and really dive deep into the report and the recommendations, the website is at the bottom, and I, of course, will share these slides with Isabella so she can disseminate them if people want to click the links that I'm sharing. So at Home Instead, over the years, we've studied the workforce and their needs, and it really has kind of surfaced in these 6 areas. And so, perhaps if you're trying to evaluate your programs, you might want to think through these various areas and see what are you currently doing? Is there any areas that you could potentially improve or offer as something new to the workforce? So time and time again on surveys of our workforce, we hear that they want training. Of course, we have our initial and onboarding training, but they really value ongoing learning and education. So sometimes that takes the form of on demand, where they can look it up kind of in the moment when they are faced with a specific challenge, but also just ongoing educational opportunities. It's really important to them. They also value the support that their supervisor provides. So having someone that they can go to ask their questions and to be in regular communication with. And sometimes these seem very basic, but you'd be surprised at how often maybe an employee doesn't feel connected to their supervisor, or for us in the home care setting, I know we have various programs and settings represented. Our direct care workers, our care professionals is what we call them. They go into the home of an older adult, and they likely won't see another coworker unless they're kind of switching at the shift change or whatnot. And so it's extra important for us in the home care space to make sure that they have somebody in the office that they can call and connect with regularly. Of course, safety, especially during COVID, and now we continue to prioritize safety and providing PPE and regular trainings to remind our care professionals or the workforce how they can stay safe in their roles. And then advocacy. I think that, in the role of sometimes a care professional or somebody working in this field, knowing that they have an advocate in their employer. Sometimes, again, there are some challenging situations that arise, knowing who they can go to and that they have an advocate. Mental health resources. Sometimes the work that we do is challenging and can be emotionally hard, to lose individuals that we're caring for, to have to deal with more, kind of just intense situations. And so one thing that we implemented during COVID and found a lot of success with and continued was a mental health hotline that our care professionals could call. So whether it's maybe through like an EAP program or even just, some sort of mental health resource can really be a great investment in your workforce if it's an option. And then the last one is recognition. People regularly express that they want to be recognized for doing a good job. I mean, if you think about all of us on this call, don't you love it when you get good feedback about, wow, you did a really great job in that meeting, or this, document you put together is really well done. That feedback, that recognition, and personalizing it is so valuable. And we'll talk more about recognition and how it doesn't always have to be something super grand. And it also doesn't have to be compensation related. It can be other ways of recognition that can really make a person feel valued and seen in the work that they do. So these are just some themes that we at Home Instead have found over the years as ways we continue to meet our workforce needs. So this is the paper that the Dementia Care Provider Roundtable published in the Journal of the Alzheimer's Association. And so within this report, there are five five touch points for hiring and retaining direct care workforce in long-term care. And again, I think what's neat about our roundtable group is it really is across that spectrum of providers. So, we are representative of home care, and there are other home care providers. There are home health care providers, also adult day providers, and then long-term care in terms of community settings, so assisted living, independent living, and memory care and support, and even skilled nursing level of care. So really that whole continuum is represented. And in one of our meetings, we decided we wanted to hear directly from care professionals, those that are working directly with individuals. And so I think, assembled a panel of 5 individuals from various care settings and brought them to our meeting and had them share with us, about what makes them love their job, what are some of the challenges, what makes them stay. It was a really wonderful day. I think we all walked away really inspired, but we came away with these kind of 5 touch points, creating high quality jobs, recruitment and reputation management, onboarding, retention, and then training and career development. So those were kind of the makeup of kind of that person-centered long-term care workforce. And so for today's purposes, I'm going to zero in on those last 2 of the 5 touch points, that retention and then the training and career development, and share the recommendations from our roundtable group. So the group talked a lot about how retention and leadership, employee satisfaction, it really starts from the top. Having leaders invest in this. So whether within your organization, it's the founder or the upper level management, having them really bought into investing in employee satisfaction and retention, because we know that that can really set the tone for the entire program or organization, and it can affect things like team morale and overall satisfaction. So having leadership that is approachable, that's informed, and most importantly, I think consistent, can really go a long way and have that trickle down effect. And effective leadership, the group talked a lot about being proactive in seeking feedback from employees through multiple channels on a regular cadence. So, you might do something like surveying, but then you might also hold periodic focus groups, or follow up on a comment that somebody made to dive a little bit deeper and get that additional feedback. And when there is maybe negative or critical feedback, using that as an opportunity to dive deeper, to explore, and not be kind of on the defense about whatever that criticism might be, but really take that seek to understand approach, and to also get back to or respond to feedback in a prompt manner, but also in a way that's visible. And so that consistency, that kind of feedback loop, but not only collecting the feedback, but responding to the feedback was, the group talked about how that's really helpful. And then having kind of that open door culture of honest communication, that can be sometimes very challenging to create, and to create that safe space for that honest feedback, because of course, the last thing you want to happen is for people to feel like they can't share their feedback. So, and then of course, addressing the needs of the team effectively is also, of course, part of that. So I mentioned, satisfaction surveys. A lot of our organizations do a regular cadence of surveying. I know within our organization, we've really doubled down on 1 week, and then 14 days, and then 30, 60, 90. So 1 week, 2 weeks, and then at the 30-day, 60-day, and 90-day points, because we find that having touch points in that cadence can help just that employee, that individual feel more connected to us as an organization. Again, for us, we're a little unique because we go into the client's home. It's not like that individual comes into a care setting where they have their other employees. We want to be sure we're touching base with them. So that's how we conduct our cadence. Some organizations do it quarterly rather, and some do it kind of at that first year of employment. But we know that within the long-term care settings, the retention rate is such that if you wait until that person's been employed for a year to survey them, you're going to miss out on a lot of opportunities to engage them. And a lot of employees don't make it to that 1-year point in our industry because the turnover rate is very high. So that's why we have chosen in our organization to not just do that annual survey, but really engage with them more regularly. Those that are in more of a kind of community living setting, they talked a lot about quality circles and having regular kind of circle meetings where they're sharing feedback and kind of diving deeper into the feedback to really understand what those surveys were capturing. So you might consider also creating those quality circles to really dive deep into the feedback that you're receiving in those various satisfaction surveys. One other thing we talked about as a roundtable was that the action on feedback. So often, sometimes you fill out a survey or you provide some feedback and there's no action taken. And that can be frustrating. It can lower your confidence level in the leadership. And so we talked about, addressing the feedback, and even if it's not an actionable item, being honest about that, providing a timeline for when action might occur, or explaining why it's not feasible and what alternative options are available. And so when that feedback is being collected, it can be helpful to, again, dive deeper into various elements of that feedback, really understand the intent, the extent of the problem, if there is an issue that you're seeing continuously or repetitively, and then taking kind of a collaborative approach to the solutions. And sometimes also, involving the individuals that are providing the feedback in the solutions as well. Often that allows for more engagement in the ultimate results of the feedback and addressing the issue or challenge. There was also discussion in the shift from the word supervisor to coach, which I thought was really interesting. So if you think about it, sometimes supervisor can have a negative connotation, or maybe there's like a negative view towards your supervisor. And so many of the organizations in the roundtable talked about switching terminology to coaching, especially in kind of the Alzheimer's and dementia space. The challenges that arise can be so individualized to the care of that one individual. We're likely all here very invested in that person-centered care. So instead, having a coach to work with you, alongside you, to help guide you as an employee or staff member, to help coach to that solution. And so using kind of more of an inquisitive coaching style can sometimes be really effective, asking those probing questions. Tell me more about it. What do you think's going on? How do you think you should handle it? What did you do before? How did that work? Instead of going right to the solution, helping that employee get to the solution on their own by coaching them. And that really, that coaching mentality sometimes really involves trust. And so you might have to build some trust and rapport with the employees before they feel comfortable coming to you and working with you through a coaching situation. But it really can foster that loyalty. They feel like they're being invested in, and also with accountability. A lot of times, if the employees invested in the solution, then they'll be more likely to follow through. So coaching is something that can be really helpful, meaningful, impactful, but sometimes you do have to train your staff, your managers, that supervisor level staff on coaching, and foster a skill set in that to have effective coaching that kind of trickles down to your frontline staff. So something your organization might want to consider is going from that more supervisor approach to more of a coach. One of my favorite things is retention programs, recognition programs. As I mentioned earlier, it's not always monetary. The monetary recognition programs aren't always as impactful as other types of recognition. And it really has to be meaningful to that person. So I know for us, on the first day of employment, or part of the new hire paperwork, we have employees fill out a favorite things sheet to really get to know them. What are their favorite restaurants, their favorite flower, just collect all sorts of things about them, so that when they do a great job, they do go above and beyond, they can be recognized on a really personal level. You can buy a gift card to their favorite restaurant, or give them a bouquet of flowers and it's their favorite flower. Those things really show that you take interest in them as an employee. You know what their favorite things are. So you can personalize it. You can also, have recognition in the form of things like scholarship programs. You can give out those gift cards, extra PTO. Sometimes that's a really popular one. Having an extra day off might be more meaningful than, a small monetary bonus or something of that sort. So again, that's where it helps to really get to know your employees, what motivates them, so that you can recognize them on a personal level. And recognition should be transparent. Let them know why they earned it, and let others know how they can earn that recognition as well. And sometimes too, individuals value private recognition versus public, and some are the opposite. So for example, if you were to post on Facebook a recognition for me, I would be excited. I would go out there, I'd like it, I'd comment. But for some people, that might not excite them. They might rather have that private recognition where you're called into the office or you surprise them during the workday and just kind of privately recognize them. So again, that's another element of kind of getting to know them. I thought I'd share just a few photos, break up the slides a little bit of some recognition programs that we do within our organization. We have a Care Pro of the Year award. And so this is last year's award. We had 10 winners, and we brought them to our annual conference and recognized them on the big stage. And it was really neat. We did a panel discussion and asked them questions about why they like the work they do, what advice they would give their fellow care professionals. So that is, of course, a big, grand way to recognize. But then we also do a lot of recognition in small ways. We have, monthly kind of in Care Pro of the Month awards. You can see that lady in the middle, she got her certificate and she's just overjoyed. And then we also do small recognition where we might take, flowers to the home of a client. We also have kind of this national recognition program where we send the feedback of the nomination to the individual Care Pro so that they can see what their supervisors or the franchise owners said about them, and we email it back to them. And we get really neat comments like the ones I've listed here, like, "Hello, I'm speechless with this recognition. Thank you." Or, "Oh my gosh, I'm sitting in my truck crying. This is such wonderful news. I appreciate it so much." So sometimes just sharing back positive feedback that you've gotten about the individual with them can really just go a long way. So again, it can be big, it can be small, but recognition is important and means a lot to people. Another really interesting kind of retention example that came out of the roundtable was a mentorship program that involved a bonus, a retention bonus. So I thought I'd go into a little more detail on that because I thought it was really interesting. So one organization has a mentoring program, which many of our organizations have something like that, especially I think if you're new to caring for individuals living with Alzheimer's and dementia, it can be helpful to have a mentor, maybe that you can shadow or go to with your questions. And in this program, there was an incentive for the mentor if that mentee, the person they were coaching, mentoring, hit certain retention milestones. And I can't remember off the top of my head, exactly what those milestones are. But for example, it might have been, after that employee has hit their 90 days and they're still with us and they've hit, they're in good standing with our organization, then you could receive a bonus. So it really motivates the mentor to invest in that employee. And it makes the other employee feel like they have someone that they can go to, that they can ask their questions to. They feel very connected to the organization. So it really kind of builds in that ownership over the mentee's success, and it can enhance satisfaction and retention, both for both parties, for both the mentor and the mentee. So you might consider retention programs such as that as well. I mentioned, getting to know the employee, the individual, the team member, and the same goes for understanding their career goals. When we're able to recognize the needs and the priorities of the employer individual, we can see increased loyalty, longer tenure, and then ultimately they often provide that higher quality of care. So wanted to talk a little bit more about that. If we're able to, again, get to know that employee, the worker, and their growth goals, we can understand what motivates them. So, just as organizations set goals, we all have personal goals ourselves too. So if you can understand during that onboarding process what their personal goals are and how the organization can support those goals, again, that can help increase their loyalty and make them feel valued. So, for example, perhaps their personal goals is to work a certain number of hours, to make a certain amount of money, to do whatever they would like with it, or maybe they are pursuing a degree, an educational degree, and so they're doing this job as part-time so that they can meet that personal goal of graduating. So if you know some of those personal goals, then you can take steps to help adapt their work environment or their schedule to meet those goals. And some are looking for that career path within your organization. I think sometimes in the industry of direct care, the feedback the industry has gotten over the years is there's not a lot of career goal growth opportunity. And so our organization has thought a lot about that and worked on how we can create paths for growth for employees. And so, some of our franchise offices have developed kind of a lead care professional role. After an employee has been there for a certain amount of time, promoting them to kind of a lead role where they can help with some of the training of new employees or kind of in that mentoring capacity. And we've also had individuals end up working for our franchise offices, kind of growing in their career into more of an office role where they're supporting kind of the operations of the business. So really understanding the personal goals, if there are career paths within your organization, helping to provide kind of a path so that the employee knows and understands how they can make it to that kind of next level of whatever that goal is. Perhaps within the dementia space specifically, a lot of organizations in our roundtable group talked about how they've created kind of dementia care specialist roles, those peer mentor roles, those training roles, where they have become a very seasoned individual in the work that they do. And so using that to help train and come alongside more those that are newer to the industry has been a great way to kind of create a career path. And then I talked a bit about education and training. We know that this is something that employees are hungry for because often they want to provide the best care possible. And so making sure that you are able to provide them with training that addresses both the medical but also the psychosocial needs of the care recipient. I think sometimes in organizations that kind of work in maybe the healthcare space, it can be very easy to focus in on the tasks, but also making sure that we're also fostering those personal relationships, getting to know the individuals that we're caring for, really leaning into that person-centered care is so important. So if we're able to continue with that training, provide ongoing training opportunities, we can see the impacts in things like a reduction in care errors, in staff injury, and those kinds of things. So reducing some of the areas of work that involve like risk and those sorts of things. And then we know that training and education can lead to that enhanced job satisfaction and retention. So again, training is so important. And I know the Alzheimer's Association has a lot of great training resources for organizations. So I know that was kind of a lot. Some of it might have been a review. Some of you might be doing some of these things already, but I wanted to really open it up for discussion and hear from all of you. What are the things that you are doing to kind of empower your team members? What are your retention efforts looking like in your programs? What are do you do any sort of recognition? So you can feel free to share them in the chat, raise your hand, come off mute. I'm very open to however you want to communicate it, but we'd really love to hear what you all are doing and what's working, what hasn't worked, what the challenges are. So please, love to hear from all of you.
All right, I know this group is not quiet.
Monthly shout outs in staff meetings. I love that.
I could say something. I'm running a program. We don't really have staff because it's a program at a university where students run it. But I have been a nurse for 30 some odd years and have trained a lot of nursing students. And one of the things that has happened within nursing, which has been extremely empowering, is this whole idea of shared governance. Are you familiar with that at all? That's basically what happens is. Well, and there's a magnet status that hospitals now can get in their nursing departments, but allowing people to have a say in policies and things that are run within the organization has really transformed, especially in acute care settings, nurses. I don't know if any of that is occurring in long-term care environments or not, but it's where nurses actually get on councils and they actually are integral in making the policies that are going to dictate what they do in the hospital setting. And that might be something that like CNAs probably are not as familiar with that, but I had read some articles on that. And I just wondered if anybody had been doing that or had thought about that as a method of empowering staff.
I love that. Having the individuals that are carrying out all the policies be part of writing them. I think that is wonderful. I think having them as part of committees or however those policies are created, or whenever there's a new policy that needs to be developed or tweaked, bringing in somebody who's deeply involved in that work can be really meaningful. Thank you for sharing that, Carrie. Marvin shared they're very, very flexible with time and when possible, work from home. I think that's great. I think, especially during COVID, we all had the opportunity, most likely, to work from home at various points or saw the value in that flexibility of maybe letting an employee come in during not your typical 8 to 5 or on kind of the off hours of a shift or modifying the work hours slightly to let them take care of whatever they need to take care of. That can be powerful in retaining employees. Is it Shelley? I think I see your hand raised.
Yeah. Well, so we have our respite homemaker and personal care program, and it's gone through many different versions of how we set it up. For a while, staff had the same benefits that all employees of our agency have. But then we brought it to the team to, choose if they wanted to have higher wages or retain their benefits. And at that time, they chose higher wages. But then, COVID hit and we just were really looking at our internal processes and structures. And we decided to make some changes because it's always sort of been viewed as like shift work in our eyes. And like, So when a client canceled and there wasn't someone that we could place them with immediately, they would miss out on pay. And so that was a really big issue. And also, where we live now, like average rent is like $2,000 a month, or average home costs are like $600,000. And so like the pay is really vital for our staff. And so we made the conscious effort to ensure that they are recognized as every staff member is with, we've now decided to not pay less than $20 an hour for our staff. And also when shifts are canceled, they still get paid as they normally would, just because they would never know what their checks were going to look like. And that was really stressful for people. So, and we just make sure that because they are out in the homes all the time, they were missing that connection with the other staff in the agency. So just really consciously giving them an office, giving them computers, to just make sure that they're recognized as the same as all the other team members.
Well, I thank you for sharing that. There was a lot of great things that you were doing to invest in your staff. And I think you make a great point that some of the uncertainties that come with caring for an aging population, of cancellations, or an older adult gets hospitalized and all of a sudden their shift is no longer needed. And so being able to provide that financial security, I would imagine, is a great retention tool. And I think sometimes in the long-term care space, pay is always something that comes up. And sometimes it is, an increase in wage that would be something that is meaningful to some folks, but to others, offering additional benefits might be more impactful. So I think understanding the needs of your specific organizations and workforce needs can help you tailor those benefits or whatnot directly to what's going to be most impactful. Thank you for sharing. Sam, I saw your hand up at one point, and maybe you took it down, but if you want to share, please feel free to jump in.
Yeah, I took it down, but I'll still share. I took it down just because I always forget to take it down, so I took it down in advance. But for those of you who know me or have heard me talk before, I started my whole career 30 years ago in adult day, and we were sort of universal employees where we did everything from help with personal care to drive the bus to doing activities to preparing lunch, all of that, which gave a lot of variety, right, to your job. But the one thing that has stuck with me for the longest time, and something that I really talk about when we talk about person-centered care and how that pertains to employees, or to staff, the one thing that I always appreciated is that this could be stressful at times for staff, right? Caring for somebody with Alzheimer's or another dementia. And it was acceptable for us to say, you know what? I need somebody to step in for me for 15 minutes so that I could get a breather. Or, hey, could you switch with me and I'll drive the bus this morning and you do the group because I'm just, I'm kind of at my wit's end, or it's too much for me today. And that didn't show that we were we weren't bad at our job, and leadership didn't make us feel like we were bad at our job because we had this break, but it allowed us to have this support system to know that if you are having a bad day, or if you're just not clicking with somebody else can step in and do that, and it's not going to be held against you. And so that's always stuck with me, because I always thought it really did make me feel recognized and valued, that hey, we all have bad days, and it doesn't mean you're a bad employee.
Thank you for sharing that, Sam. That's a powerful example. That doesn't cost anything, That's something that you can do to really make your employees feel supported. I think it goes also to kind of that mental health component too, to create a safe space and environment when you are having a tough day or are feeling that sense of overwhelmed, to have that open kind of culture of being able to speak up and express that, and to get coverage for a little bit while you just take a moment to refresh or switch to another task for a bit and come back. to that role. So thanks for sharing that. Is it Latina? Do you have your hand up?
I did. I just wanted to say that we have incentives, but we were playing around with because of the shortage on nursing staff. We were playing with that. I would think it's like the McDonald's model of daily pay, where
Oh
you
yeah.
can cash out daily. And so we've been exploring that as an option and incentive for some of our staff to keep people coming in daily and getting paid by the end of the day. So that's something we're playing around with. I'll let you guys know how that goes. But I think that will be an added incentive to keep staff coming in every day.
That's a great example. And I've heard success with that within our home instead network too, of using, I don't know what, I know there's a lot of organizations out there that can help you, or apps or payment systems that really support that model of that daily paycheck. And that can definitely be a retention tool. So thank you so much for sharing that. I also see in the chat the Bridge. I'm guessing that's an organization. They shared they always have an open door policy to come in, discuss, talk about a new idea. They work better as a team. So I love that. I love that there's that team mentality. Thanks for sharing that. Chris shared, birthday cakes, card candy, framed certificates of recognition. Those are some of the ways that they recognize their volunteers. So I think that's awesome. Thanks for sharing, Chris. Chris also shared he appreciates the form of acknowledgement. My seasonal job has a Christmas party and a bonus check. So that's another great way to recognize and support employees. There's some feedback in here about that daily pay with some mixed reviews. So it might be good, maybe Latina, to connect with Whitney. They say, or Whitney says it's a good benefit, but easy to abuse or create employee issues. So maybe setting some good expectations ahead of time would be good. Another thing that I was going to share that I thought was interesting, my husband's old job, they had a kind of peer recognition program where if one of his colleagues did something outstanding or great or really helped him out, he had like an allocated amount of bucks. I don't remember what the company called it, but dollars or points that he could send to another employee to kind of give them kudos. And then, at the end of each quarter or at the end of the year, they could kind of cash out their points or bucks in the form of like a gift card or, cash. So that could be another thing to consider, not only having a recognition program kind of from the top down, but one that's more like across the organizations where people could recognize their peers for a job well done. Because I think that also is really impactful when you are seeing somebody else doing really great work and being able to recognize them for that. So I just shared that as yet another example. I know there's so many different things that organizations can do and try, and ways that you can invest in your workforce. So I'm loving all the sharing. Anyone else want to come off mute and share? It could be retention, it could be employee empowerment. Is there anything that people do kind of in their onboarding process to kind of set the expectation or kind of empowering their employees? Or do you collect any information about the employees kind of during their onboarding process that then helps you create that recognition throughout their employee experience?
Yeah, so we do kind of similar to what you mentioned, like we have new staff fill out, like, what's your favorite restaurant, or would you prefer like extra PTO, or, and then also like, do you like it to be in private or a public recognition that way? And then we do also set aside in in our budget and planning a certain amount of dollars for employee recognition too, that supervisors can use throughout the year for various things, or if it's, taking your whole team out to breakfast or something like that too.
That's great. I love that you make it a line item in your budget.
Yeah.
Employee recognition. That's fantastic. How about when it comes to, I know we just have a few more minutes left, but the training side of things. Is anyone doing any sort of kind of mentorship or involving kind of your frontline staff in the training, whether it's the onboarding or kind of ongoing training, any coaching methods? Anyone have programs or anything unique to your training programs that you want to share with the group? Yeah, Latina, go ahead. If you want to come off mute and share, please do.
Sorry, I couldn't find my hand to raise.
That's okay. I like you raised it and I saw it, so you're good.
Okay, so since we have been awarded this grant, we found a unique way to train the staff because no pun intended, but a lot of people don't like to read, right? So we have decided to share like live stories, live testimonies. We do training with using plays, like dementia specific plays. From a local lady named Dewey Williams, who give them the real life scenario of how individuals with Alzheimer's or dementia kind of act, and how they have been known to react based on kind of our observation, or sometimes they match energy opposed to redirecting. And it seems like, and then they're hearing real life stories from caregivers on what they go through at home and who their loved one used to be before they kind of became diagnosed with the disease. And I have noticed that the compassion that was buried deep inside of them that we didn't see is starting to reveal itself, and they're taking more time and care with the individual. And I found that to be very interesting. When you put them in real life studies, like they're actually working, they're not doing it, so they're observing others and others' reactions to things. So it kind of changes how they've done things a little bit. So that's just something I wanted to add.
Oh gosh, I like that a lot. Having role play and live story sharing, I think that is so impactful. And you're right, not everyone learns in the same way. Sitting down to read about something might work for one person, but it could really come to life through that storytelling, story sharing. And I love that you have found that it's kind of opening up empathy and compassion within your employees. And I think that is such an important quality to have when we work in the variety of settings where we're serving older or individuals with cognitive impairment. So that's fantastic. And I saw in the chat somebody's asking more about the plays. So Latina, they might be getting more information from you. It is a very unique way to share information. I think we have learned through our training, having a multimedia approach is really impactful. And today, we kind of live in this Instagram story, TikTok culture where people take in information in really short sound bites and videos. And so incorporating that style of learning into your training, or even in those kind of ongoing training opportunities, those quick refreshers in more of those small kind of digestible videos or sound bites can also be impactful. So fantastic. I know we just have a few more minutes left. Did anyone else want to share anything that they're doing in their training, onboarding that's unique?
There was one comment I just want to read from Rebecca. She had noted that within the first 90 days, each employee is personally introduced to every other employee from the CEO down, and then we meet weekly for one-to-one meetings with teams and across the agency to check in.
That's fantastic. Thank you. I missed that comment. I really think that that is fantastic. That those personal introductions, so meaningful and impactful. Those check-in meetings one-to-one, that is wonderful. I know that, again, we come from the home care space where, traditionally a direct care worker would walk into the home of an older adult, and that can be kind of nerve-wracking doing that for the first time. So we do caregiver intros where someone from the office goes with to introduce them to the client for the first time, whether it's the client's first visit or if that care professional is their first visit. So those personal introductions can really go a long way. And then one last comment, verbally thanking someone every time they're working with you, being really grateful. Sometimes they're surprised by the praise. I think that, Chris, that is, a thank you seems so simple, but you're right, it can go such a long way. And that's why I love sending out my kind of quarterly recognition emails to say, hey, somebody nominated you for this award, and this is what they said about you. They're always just like, oh, that's so neat. I had no idea. So I think it's important to let our those that work for us or volunteer for us, let them know how much they are valued and appreciated, and find ways to recognize them, ways for them to give their feedback, and hopefully that will help with the retention of employees that I know we're all faced with in our various settings. So Isabella, thank you so much for allowing me to come and share that. If you want to read more about that article, I did link to it I think on about every slide of that presentation. So I know the roundtable, we put out regular publications. So I know the Alzheimer's Association does a great job of sharing that information out. So thank you for all the work that you all do, providing respite. That's such an important service. And I know so many families are benefiting from the care and support that you're providing. So thank you all. Wishing you happy holidays and a happy new year. Thanks again, Isabella.
Yeah, thank you, Lakeland. Just for the good of the group, I will be sharing the recording and the presentation and linking the article as well in our follow-up communications. So thank you all for joining us. I hope you all have a happy holiday, and we will talk to you soon.
Thanks, you too.